Hi there, I'm Jamie Ferracholi, Project Coordinator for the Inland Empire Health Information Organization, and I'd like to take some time to share ConnectIE with you. ConnectIE is a community resource platform that addresses the social determinants of health by connecting community members with community-based organizations, or CBOs, that offer critical resources at either no cost or reduced cost. ConnectIE is completely free to use, and anyone with a computer or mobile phone can use it. Social determinants of health are the conditions in the environments where people live, work, and spend the most time, and they affect a wide range of health outcomes and risks that can tremendously impact a person's well-being and quality of life. Examples of social determinants of health include housing, transportation, and neighborhoods, racism, discrimination and violence, education, job opportunities and income, access to healthy food and physical activity opportunities, polluted air and water, and language and literacy skills. Research suggests that up to 90% of our health status is determined by these social determinants, and those such as low education levels, racial segregation, low social support, and poverty can increase death rates among disadvantaged populations. Think of a friend, family member, or patient you know who lives in a disadvantaged area within the Inland Empire that has no grocery stores or restaurants that carry healthy or organic foods. Let's call her Jane. Jane is more likely to endure poor nutrient intake than Sam, who lives in a largely more fruitful area and has access to a Whole Foods market and many restaurants that carry organic foods. Because of the poor diet Jane is forced to tolerate due to her social determinants of health, she is at greater risk of health conditions like heart disease, diabetes, and obesity than Sam is. As you know, these factors can decrease her quality of life and lower her life expectancy significantly. Let's use some statistics to put these social determinants into perspective. The geographic pattern in poverty rates has remained essentially the same over time, with communities in the southeastern and southwestern regions of the U.S. experiencing higher poverty rates than those in other regions of the U.S. There are wide disparities in unemployment, such as many counties in southeastern, southwestern, and western regions having at least 9% of the workforce unemployed from 2011 to 2015. Ethnic minority groups are more likely to be without health insurance than non-Hispanic groups. In 2015, 6.3% of non-Hispanic individuals lacked health insurance, compared to 11% of African Americans, 20.7% of American Indians and Alaska Natives, 19.5% of Hispanics, 7.8% of Asians, and 9.9% of Native Hawaiians and other Pacific Islanders. Access to health insurance also varies by education, income, and employment status. In 2015, for example, 22.8% of adults with less than a high school education lacked health insurance, compared with only 3.9% of adults with a college degree. Nearly 28% of unemployed individuals lacked health insurance, compared with 11% of employed individuals. In 2015, 17.2% of those with income levels below 138% of the poverty threshold were uninsured, compared with 3.3% of those with incomes at or above 400% of the poverty threshold. Now that I briefly touched on how social determinants of health impact disadvantaged populations in the U.S., I'd like to point out one major difference between us and other industrialized countries. The U.S. spends more on health care, but less on social services. And for this reason, rather than focusing on prevention and elevating people's health, providers are forced to focus largely on treating patients after they have already experienced consequences of health disparities influenced by their social determinants. It's important to note that promoting healthy choices alone will not eliminate health inequities. Rather, increasing awareness around the different conditions in which Americans live, work, and spend the most time helps illustrate why some communities are healthier than others, and why some populations struggle more than others to be the healthiest they can be. And that is where ConnectIE comes in. We are here to help improve the conditions in our community members' environments by connecting them with social services and critical resources they can afford regardless of their social determinants of health. Now let me share some of the ways ConnectIE and its partners have worked together to minimize the impact of social determinants in our communities. IEHP has held weekly one-day food distribution events since summer 2020, where additionally IEHP and its partners, including Desert Healthcare District, have been hosting drive-through and walk-up vaccine clinics on weekends since February. Desert Healthcare District alone hosted 22 vaccine clinics in February and March. All these special community events have made registration available through ConnectIE, and nearly every one of these events has reached full capacity, totaling thousands of community members helped. Additionally, the ConnectIE outreach team, which includes staff members of Inland SoCal United Way and the Inland Empire Health Information Organization, have been collaborating on the ConnectIE Facebook and Instagram pages to raise awareness of ConnectIE in our communities. We've done this by posting at least once every single day since summer 2020. Each post contains the details of a specific resource offered on ConnectIE, the best way to get in touch, and a call to action for all those who would benefit from that particular resource. Each post reaches hundreds of users, while our monthly paid posts reach in the tens of thousands of users. All these results are directly reflected in the number of searches entered and referrals placed through ConnectIE on a daily basis. To exemplify ConnectIE's reach in our communities, the total number of searches for resources in Q1 of 2021 was 40,394, which is a steady average of 450 searches every single day. In recent months, referral utilization on the platform has also increased. To briefly illustrate what a referral through ConnectIE is, I'll give you an example of an individual living in the Inland Empire who was low income and uninsured. Let's use Jane again. Jane and her family are experiencing food insecurity, and she has shared this information with her physician. Let's call her Dr. Smith. After leaving a routine checkup at Dr. Smith's office, Jane gets an email letting her know she's been referred to an IEHP food box event this upcoming Monday, and the best way to get in touch is to call the agency to register. If Jane calls and registers, IEHP will update Jane's referral status in her seeker profile, which Dr. Smith can then view in her People I'm Helping dashboard, and this is where she can view all the patients she's referred to programs in their care history. So next time Jane comes in for an office visit, Dr. Smith can just pull up Jane's seeker profile in ConnectIE and be able to confirm whether or not Jane received this service. This closed loop of care is one of the metrics whereby we measure ConnectIE's success as a community tool that minimizes the impact of every individual's unique social determinants. Another way this closed loop of care can be fulfilled is by Jane referring herself to a program. The same email would be sent to her indicating the best way to connect, and she could then track her own referrals in her seeker profile. This method is one of the most efficient ways to help our community members be independent and confident in their ability to provide for themselves and their families, despite the hardships they may be currently experiencing. Now that I've demonstrated the referral process, let me share a bit of data on referrals. In Q1 of 2021, the closed loop referral rate was 90%, which is an incredibly high percentage given that some individuals who are referred just may not wish to connect with a particular program. 97% of all referrals made through ConnectIE received some kind of response from the CBOs to which they were referred. Again, this percentage is extremely telling of this platform's ability to get individuals in need connected with the agencies that address that need. Healthcare professionals like you are noticing the power of ConnectIE to close gaps in care and reduce their patients' social determinants. In fact, several hospitals throughout the Inland Empire have integrated ConnectIE directly into their EMR, which means physicians can launch a patient's seeker profile from their electronic chart and follow up with the care they've received outside the office during a routine checkup. ConnectIE is very easy to use, and as I hope I've demonstrated through this presentation, the ways it can be used to help people reduce their social determinants of health are truly immeasurable. Now let's dive into the ConnectIE platform and learn how to use it. As a provider or other healthcare professional, your plate is probably pretty full. And the beauty of ConnectIE is that patients can navigate the platform and connect with programs all on their own. However, this process does start with you. You're the one who will let your patients know about ConnectIE and explain how they can use it, which means you yourself should have an understanding how the platform works. First, navigate to connectie.org. Here you'll find some great COVID-19 resources and some popular categories featured down here, right on the landing page. You can also instantly translate the site into 70 plus languages with this drop-down menu here. And of course, we have this nice little button for Spanish. Click here. This is for our native Spanish speaker population, which is quite robust in the Inland Empire, as you know. Another great feature on the landing page is the personal needs assessment. If you click this link, it will open a new tab with the protocol for responding to and assessing patient assets, risks, and experiences form. This form is a great tool to use if your patients are unsure what kind of resources they need, but they are sure that they do need help. The form does ask quite a bit of personal information, and this information is, of course, kept entirely confidential. The only reason why it is collected is so that the search results that are given to them on the next page will return very relevant results specific to their needs. Now let's go ahead and enter a sample search. I'll just go ahead and type in food here. And because I live in Riverside, I will type in the generic Riverside zip code and click search. So a couple things to note here on this results page. There are some filters, personal, program, and income eligibility filters up here at the top. These are specifically to narrow down the results and make them more relevant to an individual and their situation. So we won't really go into them in this demo just because it's kind of a lot, and your patients can go ahead and check these out, or when you have time, you can go ahead and check these out on your own. One filter you do have to apply is whether you want the results sorted by those that are most relevant to your search or those that are closest. Because we searched food, which is a very general term, we'll go ahead and sort by those that are closest. However, if you search something very specific, such as food for pregnant individuals who are near homeless, then that would be something you might want to sort by most relevant. Let's go ahead and take a look at this program, More Than a Meal by Family Service Association. Right here, this little ACEs reviewed tag means that this program has trauma-informed individuals working there who are sensitive to those adverse childhood experiences. So this is a good program for a patient who you have identified as having an ACEs score. If we click more info, we'll see all the information about this program. Any eligibility requirements would be here, the availability of this program, the description, the languages it serves, and whether it's free or reduced cost. There's also next steps here and a program website if they do have one. The coverage area would be Riverside and San Bernardino counties. Some only cover one or the other, but some do cover both. And then many of these programs on the platform are going to cover all California residents. So it really does vary by program. One nice little thing here on the program description is the hours and a Google map, where if you click, will open into a new tab and you can print it out, hand it to your patient, or of course they could print it out for themselves. Now I want to show you how to take next steps on a program. And this is a very, very important step because there are many different ways to get in touch with programs. If you click this teal button here, see next steps, this is the best way to connect with this particular program. So calling is the best way to get in touch. And I sort of went over that when I gave the example of doing a referral. If you are helping someone else, you can log a referral, but this program does not accept referrals. So that bidirectional communication would not occur between this program and the individual being referred. However, if we go down here to this IEHP food box, the best way to get in touch is to refer. And of course, I already showed you how to do this, so I won't show you again. Now I'll show you how to share a program. Sharing a program basically means that the link for the program would be sent to the email or text that you enter here. Another way you can share is on Facebook. So if you click on this button here, a new window will pop up and prompt you to sign into Facebook. And then that way you can share this program as a status update for all of your followers to see. This is useful for you as a provider or healthcare professional. This is also very useful for patients themselves because the individuals who follow them may benefit from the same resources that they do. The next important step I'm going to show you is how to save programs. If you click this button here, it'll show you that you can either create a new folder or you can pick a folder that's already existing. If I create a new folder, I can just type in emergency food and save. And now this program is in the emergency food folder. I can go to my save favorites to find it again, or I can save it to an already existing folder. So these are all the folders I have already created. For the sake of the demo, I'll just save it to food and show you what that looks like. Now we can go to my saved favorites. The benefit of saving favorites to folders is that you can actually print out entire folders or share entire folders. The same step would be taken to share an entire folder, either as a link through text, email, or social media, or as a direct email. You can also print an entire folder full of programs. So instead of just printing an individual program and all its details, you can print this whole page, which would give all of the information you see here, plus the hours of operation. And another cool thing about printing is that you can print in any of those 70 plus languages that are available for translation on the landing page. You can also share in any of those 70 plus languages. So keep that in mind if you're going to be searching on your patient's behalf. So if they're primarily Spanish speaking, but you don't know any Spanish and you want to make sure that they understand all the information that is present on that text or email, then you could translate the entire message plus all the program information into Spanish so that they have a very clear understanding of how to get help from that specific program. This is the People I'm Helping dashboard, which I mentioned earlier when talking about referrals. The cool thing about the People I'm Helping dashboard is that you'll see everyone who you've started a referral on. As you can see, I haven't referred a whole lot of people because this is just a demo environment for me, but you could actually refer all of your patients or any number of your patients who you believe would benefit from a particular program. And then you'd be able to see all of their names here, and then just go ahead and click on one when you want to view their seeker profile for more details. If you click on the name of one of the people that you're helping, you'll be taken to their seeker profile. This is where you can add any goals or personal information on them, any forms or documents that you want to add. Some programs do require eligibility forms to be submitted with a referral. In this case, you or the patient themselves could upload that here and then send that with the referral. And then that way, you wouldn't have to go through the extra step of having the program reach out and asking for that eligibility form. The navigation history is where all your referrals live. So if we're looking at this referral history from a provider perspective, then this is a program that you referred your patient to, the date you referred them, any status that you set for it, or if they went in there and updated the status for themselves, then you would see all that information here. You can also add a note for your own personal reference, or if your patient also has a ConnectIE account, they could actually access all this information on their own seeker profile. So if you add notes for them, they would see it, they would be able to take any action that you suggest, and that way you're both looking at the same information at all times. So I've given you a lot of information about some of just the basic features that ConnectIE has to offer, but I want to really highlight how easy it is for an individual to find resources and get connected with those resources. And by doing that, I'm just going to pretend I am a community member in need of help, and I'm going to take next steps on a program. I'm just going to type in food, my zip code, sort by closest. So I'll go ahead and check the boxes for female and homeowners, and that way I'm going to narrow down my results to make them a bit more relevant to my personal needs. Now that I have these personal filters applied, I'm going to go back down to the very first result. This one, CalFresh, is something that maybe I'm interested in. And if I click this See Next Steps button, I will be taken to a new tab where the application can be filled out directly on this program's website. If I want to pursue more than a meal, I click See Next Steps and give them a call for more information. If I want to pursue this emergency shelter, click to see next steps, call for more info, or to get services. But basically, all one really needs to do is make sure that they are eligible for a program they want to take next steps on, and then get in touch with that program. However, this teal button says the best way to get in touch is. Just by doing that alone, that full closed loop of care can be provided. There are many other features that can be utilized as a provider or as a case manager or medical staff member. At the bottom of the homepage, there is also the ability to suggest a program way down here at the bottom. And what this means is that if there is a program you know of that isn't on ConnectIE, or you don't see it and you think it might not be on ConnectIE, just click this button. You'll be asked to enter a bit of information about the program, at the very least the name and the city where the program resides, and then that request would be submitted to the vendor, who would then either approve or reject the request to add that program to ConnectIE. The only reason why a program would not be added to ConnectIE is if it's not a nonprofit or social service or healthcare program. You can also claim programs with this button here. Claiming programs is mostly a feature that the CBOs use because they're the ones who have the programs on ConnectIE. But if your hospital or provider office does have some kind of program that you believe the public would benefit from and then get it added to ConnectIE by the vendor, then you could go in and actually claim the program, say that you work there, and then be able to manage the program information. And our goal is to have all the programs on ConnectIE claimed by the organizations that offer those programs. The last thing I want to mention is that you don't have to create an account to be able to find resources and follow up with next steps. So as a community member, there is no necessity to create an account unless, of course, you want to save favorites or you want to be referred or send referrals. So I do want to make that distinction very clear. You can share a program by text, email, or Facebook post without having to create an account on ConnectIE. However, if you want to save programs or be referred to a program or refer someone else to a program, you do have to create an account. And to do that, all you would need to do is click sign up, enter your information here, and sign up with either your email or your phone number. And I do just want to mention that you or your patients will never receive spam of any kind from ConnectIE. This is entirely just to sign up. You will receive that one-time registration confirmation, and then the only communication you'll receive from ConnectIE in the future will be if you refer someone to a program, or if we're talking about a patient, they would only receive texts or emails if someone has shared a program with them or referred them to a program. We in the healthcare industry believe all physicians, case managers, and medical staff should know how to help their patients navigate this platform and get connected with the resources they need. Please reach out to me or an RCMA membership assistant to get a training scheduled for you and your staff. You may also call me directly at any time at 951-368-1009 for more information.